5:31, we can call the meeting
Yes,
to order.
so,
This is stuff
oh,
we-
sorry.
Are you ready?
We're talking about,
Yeah.
he's trying to figure out if this is snuff. It's the one where you like put it in
Oh,
the back.
that stuff.
Yeah.
That's weird.
So we're calling the meeting to order. It's 5:31. Roll call. Council member Elaine Motion Campoli, I am here. Council member McHugh.
Hello.
Here. Council member Matheson.
Here.
Also here. Great. Did you have a chance to review minutes? Any concerns?
Nope.
Feedback? Anything? It looked, very thorough to me.
Very thorough.
I always appreciate the thoroughness of the minutes that we get, so thank you. All right. Oh, Bonnie, I think you were here with our last meeting, so thank you. Okay, so the topics. Okay, our first one, the cooling center research. So I have a few updates. I think Don, do you have some updates? I think you
Only
done
the
some
things that I
research
told you.
too. Yeah, do you want to share and then I'll share the updates too?
I never remember the new name for the Lord's Table.
Oh, Your Safe Haven.
Your Safe Haven. The director there told me that she could do that, but it would require $1,000 to help with their electric bill for air conditioning, and 3 volunteers to staff the facility.
Yeah.
Other than that, no one else. Like the city in Neal Park, that room that I had talked about, is not air conditioned, so
Oh,
it doesn't
good to know.
apply. And Kayla at the youth center, he said that only during the hours that they're open and
Yeah.
only for the people in the age group that they serve. So nothing too promising.
The only thing I can think with Your Safe Haven, potentially, a piece of feedback we could give there is that there is the OCI grant.
Yeah.
That might be something that they could apply for, as, something if they are looking for something to help their budget, I know we have volunteerism on here, so I don't know that we're an immediate solution for volunteers, but, that's certainly something that we could work on, developing.
It probably isn't gonna come together this
Yeah,
year though,
yeah.
because we're already in
Mhm.
July.
Okay. All right, that's good to know. So the ones that I had contacted, so I had done some follow-up about the Armory, because that seems like a wonderful location, but again, they don't have the AC. And also, there's just some things in transition there, so that is not ideal. The other ones, I had spoken to Springbrook. That was one of the other ones I followed up with. They were very supportive of the idea, but they do not have a space to dedicate to that either. Even that hallway space, they said, does not have like a very high power AC, I guess, so they didn't feel confident they'd be able to meet that. I did speak with Seth Haight, who is their, I forget his title, but he is right below the CEO there. And he even said, if they had a vacant department or something, they would love to work with, a program like this, but they don't have anything available right now. But they'll keep it in mind. And then the other one, I think we're going to have to wait for more updates next time. So again, more of the long-term research than an immediate fix is this idea of using OPT rides as a way for people to catch, to cool off, and figuring out how vouchers or other things might work for that.
So that would be people interested would just take a bus ride but not go anywhere really. They just
I
make
think
the loop.
figuring out the logistics and how that all works, because those bus rides still need to be accounted for with a fare. So we'd need to figure out, like Catholic Charities has some vouchers, and it's I think really a matter of working out the logistics that would be involved with implementing a system like that.
What about capacity?
That I'm not sure about. So those are all questions, again, I think they would, have to be discussed in the details of it. So, and I think somebody was on vacation too, was the reason. It's that time of year, and I think there was a vacation in the midst of it, so we have to wait until people get back from vacation to, look at that more, so.
So I would have 2 questions about the bus ride. One is the capacity, if they have the capacity, and I think they do. The other thing is, would it be all routes or just like, say, the circle one that goes to the south side and then back to Main Street? And could they get off at the mall and walk around the mall and wait for the next bus? Those are the kinds of questions I
Yeah.
would have with the buses.
Yeah, sure. I think those are, definitely things. Yeah, and so Dave Holtailing is on vacation, and he's the one that we need to talk to,
Mhm.
about the bus system. So, yeah, I think those are all things that we can keep in mind as we continue to investigate that. Any other?
Good
there's
idea.
Yeah, there's one other thing that
Mm-hmm.
the bus terminal will be air conditioned when it's opened, and it'll be open for next summer.
So
But
that's,
do we
yeah.
wanna have people hanging out there? That's, those are questions to
Yep.
consider. But the important thing is that we get something.
Yep. All right. So we'll keep plugging away at this, it sounds like. And I think it sounds like by next month we can have more of an update about OPT and discuss that more.
Mm-hmm, yeah.
But
Are
it's
you
a
good
gonna go
idea
to that,
because-
Yeah.
They're utilizing the bus route and they're not utilizing, but they're just running anyway.
Yeah,
So-
exactly. That's and when I spoke to folks about this idea, I said we're not trying to create a new site or something brand new. What we're trying to do is build on already existing resources that could be furthered. So, okay. I don't know. And churches, I don't know if we've had any luck with churches. Shannon,
Well,
have you
St.
had
James is
contact?
the same
Yeah.
answer as him because it's the
Okay.
same program.
Oh, okay, gotcha.
But very open to, participating.
Yeah. Okay.
And
Are their facilities air conditioned?
yes.
All right.
But yeah, I look forward to hearing more about the bus idea.
Yeah.
I think it really does build on in a brilliant way.
Yeah, like those already existing
Right.
resources.
We're spending
yeah.
that money
Okay.
anyway, that gas, that employees' time.
All right. Okay. So if that's all we have for that, we'll come back to that next month and, see what we can find out about OPT. And that would bring us right up to the tobacco licensing legislation. And thank you for coming again. I know I have had the chance to hear Jennifer Hill tell us about this, but it was probably almost a year ago now. I was new on the committee at the time, and now we have two newer members, so I know I was here last month trying to answer some questions, but I didn't feel like I could adequately fill in, the knowledge that you have, so.
And, I did look at the draft of the, policy, that I guess Katie and other people had worked on during the year, but, probably a lot of this will be trying to get back on the page and what the same page is.
Yeah, yeah.
But anyway, I work with tobacco-free communities, Delaware and Seacoast-Schoharie. It is funded by a grant from the State Department of Health. And there are like 19 other organizations like mine that do local work all over the state. And what I mainly do is interact with local governments like this, employers, residents, about basically how to reduce smoking rates, how to prevent kids from starting tobacco use. And a lot of what we do is we build tobacco-free spaces where we live, work, and play. And so mostly what I've done is worked with local governments, including the city of Oneonta and the town of Oneonta and throughout the counties, to create tobacco-free outdoor policies, usually in parks, but it can be any municipal property. Employers can make their outdoor areas tobacco-free. And what this does, it's all about changing the environment. And the more you have those tobacco-free outdoor spaces, smoke-free housing for apartment buildings, the less normalized tobacco use is. And it reduces exposure to secondhand smoke. There's no safe level considered by the U.S. Surgeon General. And the big thing is it helps prevent kids from ever starting. So 90% of adult smokers began by the time they were 18, 99% by the time they were 24. And tobacco industry advertising is largely geared at kids, even small kids. So the big thing about tobacco retailer policy is, it's about, you know, it centers really on trying to prevent kids from starting tobacco use, because if kids start using tobacco by the time they're 18, even 24, they're likely addicted for life. Now this is going off more on smoking, but you know, we now know that vaping is the big deal with kids. New York State's tobacco control program has been great for smoking. The rate is now 2.1% among high school students, but it's almost 20% in terms of vaping among high school students. So, the big thing it looks like this committee has been working on for the past year is adopting a policy that involves licensing the tobacco retailers. And that can be a very effective way of reducing density of tobacco retailers, reducing the number. You know, it can help reinforce state and federal laws around tobacco products. So for instance, New York State banned the sale of flavored disposable vapes in addition to pre-disposable vapes. So in 2019, there was a big congressional law passed that banned flavored vapes, but then the tobacco industry came up with disposable vapes, which skirted the law. And the big thing about flavors is that that's what's attracting kids to vaping them. So anyway, New York State has a law banning the sale of disposable vapes, but there are loopholes in it right now that prevent it from being as effective as it could be. So most youth who vape, they vape flavored ones. So anyway, one of the big ways to help reduce, you know, high rates of smoking and vaping and other forms of tobacco use is regulating tobacco retailer. And at the federal level, there was a certain amount of that going on, but for one thing, usually at the federal level, things take a long time to happen. And the Trump administration has also enacted big cuts. It eliminated the CDC's Office of Smoking and Health, and it greatly reduced the FDA's Center for Tobacco Policy. So at the state level and even at the local level, people can do a lot more to help, you know, what I just said. So anyway, also there can be zoning laws to help sort of contain tobacco retailers and kind of trying to prevent the number, but it's usually not as effective as licensing. Again, with licensing, you can do a lot more with it. You can, like the fees that you charge the tobacco retailers can be used to enforce the licensing. It can be used to enforce federal and state policies as well as any new local policies, things like that. So, you know, when it comes to tobacco use, this is all very interwoven. And I actually forgot to bring the numbers in with me, but a couple years ago we did a survey of tobacco retailers in the town and city of Oneonta. And like a few of them had gone out of business, I think probably in main part because of COVID, but more have moved in, have replaced them, and there were also businesses like Friendly's, which, you know, wasn't a tobacco retailer and has been replaced by one. So, you know, it's sort of about like, how do we want Main Street to be, you know, do we want it to be sort of more family friendly? You know, a lot of people still sort of think of tobacco as this normal what's the big deal kind of thing, but again, the problem is, most people start using tobacco when they're still kids. And so it's not really a choice, and you get addicted more quickly to that product as a youth than you would if you were older, and it makes it harder to quit later on. So it's sort of all that feeds into this.
What percentage of adults in the state of New York are still smoking cigarettes?
So the statewide average is 11.3% as of, I think it's 2023. The last figures we have for the 3 counties that I work in are from 2021. Otsego County's rate is, I believe it's like 18.3%.
So we're,
Yeah, and the thing is, statewide, the average is pretty low, but rural counties tend to have higher.
yeah, that's what I was gonna ask. I thought I
Yeah.
remembered you telling me that. And you know, I found the list that you gave us in January. I think this is the current list. But I remember you sharing the details about, you know, comparing different counties and areas
Mhm.
in New York State. And yeah, Otsego County seemed,
Yeah, and it's not,
Right,
so,
yeah.
Schoharie County, so this is of the 3 counties I work in, has the highest, it's over 20%.
wow.
Delaware is, in 2021 was just a little over 16%, and it had the highest rate before then of the 3 counties. Shenango has the highest rate in the state, which is over
Oh, really?
28%.
Wow.
Yeah.
And the numbers are just so
Yeah,
scattered, yeah.
yeah, they are, and tobacco, you know, smoking rates align with poverty rates, and so lower income people tend to smoke in higher rates. People with mental illnesses, use tobacco in higher rates. LGBTQ members do. Black and Hispanic people tend to smoke menthol cigarettes, and this all has to do with advertising from the tobacco industry. So if you go back to the early 1950s, the tobacco industry started sort of making the African American community menthol smokers, like through like just all kinds of different advertising, funding the civil rights movement way before anyone else was, establishing scholarships for African Americans to go to college, and I mean, it's very cynical, but the same kind of, a similar thing happened with the LGBTQ plus community. The tobacco industry was very homophobic, and then in the 80s it suddenly realized, oh, there's this like energetic, thriving gay community in the Castro district of San Francisco, and so they started marketing products to that, and part of like attracting that group to their products was to fund AIDS research. But, you know, while they're doing that, they're marketing products that will kill half of them, you know, before they, you know, reach a normal lifespan. So, you know, it's very,
It's just interesting because I remember growing up, and I would be dating myself,
that's okay, I
Well,
do that all the time.
when I was like 5, 6-ish, I remember like, you know, people getting like Marlboro jackets and like a
Yeah.
Yeah.
Marlboro tent
Yeah.
and like everything was everywhere, and then all of a sudden it was just like nada, nothing.
Right.
Yeah.
Right,
It went, it
because
was such a stark contrast.
there was an outcry about that kind of marketing to attract children, who, like, I remember, and so this is obviously way before I did this work, Joe Camel,
Yeah, I was
the
gonna
cartoon
just-
character.
yeah.
And I remember, like, you know, the big thing was, you know, that cartoon character is to attract kids, and I thought, no, it's not. And now here I am later, like, of course it was. But, you know, like, it wasn't just the cartoon character, it was marketing all these products that were intended for kids, like backpacks, like jackets, you know, all kinds of things. And then with vapes, a lot of that marketing is online. together in vaping. Just one last thing,
Yeah.
there are now video vapes that are like a video game combined with a vape. And you can use it to record like how often you've vaped, like on websites in competition with other people. And these games, they're not really fancy right now. I have a feeling they're gonna get fancier, but there's one game that basically it's like the little pet shop game that was out,
Yeah.
where you feed the pet through.
Tamagotchi.
like,
Yeah,
Well,
yeah.
you do the same thing, but with vaping. You feed this little
Yeah.
pet by vaping.
It-
And I
yeah,
mean-
it's pretty-
But you're
pretty
not
twisted,
getting them
but-
in New York State. That's just not
Yeah,
that you. They won't. Yeah, I'm gonna be quiet. The game ones you're saying they're getting in New York State.
well,
'Cause
you
you
can
can't even
easily order
order.
them online.
You can't even order anything into New York. You're not. Okay, I'm gonna be quiet.
Yeah, I'm not sure, maybe they are.
I think it really depends, but I
If
mean,
you
I
have a
talked
New
to
York
people who
address,
bought the
then you're not
vapes,
gonna.
and- I mean, the video vapes.
Mhm.
Yes,
I had, when I read the proposed ordinance
uh-huh,
online, there was a paragraph about that indigenous peoples were exempt, but I didn't see it in this printed version. That sounds discriminatory towards me, that, you know, to isolate one group like that. And
Well,
is that
hold
still in
on.
there?
I think they have
Wait,
cultural
what?
considerations,
Hold on.
maybe, but I'm not sure. I have to
So-
go back and
Flo.
read
Yeah,
it.
well,
Flo.
discrimination it's unfair treatment if you single out any group. And well, let me tell you what my concern is. I don't want the city to get sued by one side or the other.
Hold on. As somebody who grew up around reservations and tribes selling cigarettes and having shops and stuff and gas stations and community centers and stuff like that, they make special. They have special like access, right? That's worked into. I mean, so much oppression, so many bills, right? And so this is something that is typically worked in that they have access to be able to
Right.
sell in
But
these shops.
You didn't listen to what I said. It was I don't see it in this printed version.
You're saying you want it in this version.
No, I'm not saying I want it or don't want it. I'm asking if it's going to be in.
Well, that,
And, well, let me finish.
yeah,
And if it is, we should ask Dave
Yes.
if that's legal to be in there. That's all I'm saying.
so I will say.
I'm not a lawyer, I don't know.
Yeah, I think this draft came from Katie, so I think we'll just have to look. And I don't actually, I just did a search in the document for it, and I don't see it. She
Okay.
sent out 2 drafts though, so I wonder if
Alright.
it was in the previous draft.
Right,
We can
again,
ask
I don't
her
know
about that.
what's appropriate to have it in or out. I just don't want a legal problem as a result. That's all, I'm just asking a question.
So then definitely let's send it to Dave because this is agreements that other
Mhm.
communities have with tribal members.
so
that's something
the big thing that has happened over, I guess, especially 5 to 10 years, is that there are American Indian tribes who use tobacco leaves as part of like.
It's a ceremony.
Ritual.
Yeah.
As part of ceremonies, and so there's often a distinction between commercial tobacco
Yeah.
products and something like that, and yeah, normally that kind of policy is going to be on a reservation with,
Right,
the
there's
tribal
no
leadership.
taxes on tobacco sales and reservations, and I'm familiar with a lot of this. As a little kid, I was inducted into the Shinnecock tribe, I'm 1/16 Shinnecock, but that's not my question. None of that is what I'm asking about. I'm just saying, the question was, what will be in our local law, and will it be legal? That's all I asked.
Right,
So-
and,
Yeah, just that it'll be up to us to determine, and I think we're gonna have to go back to find out, because I don't see that in these
Okay.
examples. I don't know if maybe it was in one of the other documents that was sent, but we can
Yeah.
find out.
Yeah,
and it, like, it doesn't sound like it's necessary to have that in your policy, given that this is not a, tribal government and
Yeah.
everything, but obviously it's
Yeah.
discussed with the attorney, so.
I want to avoid a problem. That's all.
Right.
The other thing, have we discussed what kind of a fee would be involved with the licensing?
You know what, since this just came through this afternoon, I have skimmed it, but I honestly have not had a chance to really read through it very carefully. But I think that is where it would
Because
be established
that would be
here.
something that we
Yep.
should do, and I think it should be high.
That was part of penalties, 500, a
Those
civil
are- those are-
penalty, not to exceed $500 for a
But
first
that's for if you
violation.
violate,
And a civil penalty not to exceed $1,000 for subsequent, and then suspension or revocation of license.
the 500 and 1,000 has to do with you violate,
Yep.
but I'm talking about to get the license.
Oh, to get the license, oh, I thought you
Right,
said,
right.
okay.
So
The
what I'm
fees,
suggesting
yeah,
is that
it
we have
was in
it
here.
significant.
We had talked about the license, and I don't know if that is established in here.
I believe too, it's an annual fee.
Yes, so what we had talked about was that there would be, and Jennifer, you probably know this much better than I do, but what I recall is that we talked about setting up an annual licensing process, where on the first year, everybody would have to go through that process, get
That's,
involved,
we
and
have that
then we
here.
would,
That's this.
yep, and
Right.
then the idea is over time, as businesses close, we can then reduce the number of licenses. And is that correct, Jennifer? That's how I remember we talked about it, that over time, we can reduce
That's
those
in the ordinance.
licenses offered.
That's in the ordinance,
Yeah,
right.
yeah,
You can't, if the company goes out of business, then we don't replace
Yeah.
that license. What I'm suggesting is that we have a significant cost to the license.
sure, okay.
But we should probably, don't we make a recommendation as to a number?
Well, do we, or would that be in the fee?
I mean, I think it's into
schedule?
legislative.
I was gonna
for
say,
me.
that might go into
But
the fees,
I-
I don't know if it would go here.
Or, I mean, what
Yeah.
kind of fee are you talking about?
Well, I
Because we
don't
don't want it
know.
to be preventative of people being able to be in business like Center Street Deli or other places were open.
Well, it's open to discussion. I don't have a number in mind.
Do you have a sense, Jennifer, of what other
So-
communities may have used for that kind of fee?
Different municipalities in New York State have done different things, and so, I can send these links to all these documents. The Public Health Law Center, which is based in Minnesota, is the New York State government's policy arm in tobacco issues. So they have a model, retailer licensing policy, and then, another document has, like a menu of different towns that have done different things, so,
Okay.
I
so-
mean, I wanna say that, I think I've seen some towns, like the licensing fee is like $100, and, just so you know, there's already a state license fee that they
Right.
pay.
Right.
And I think there are two separate registration fees for selling cigarettes and for selling vapes.
Okay.
So it's another thing just to keep in mind that they're also going to be paying those. And then the other thing to sort of keep in mind when, deciding on the registration fee is, the use of that to enforce the policy is usually what you
Yeah.
wanna do. So, kind of using that to figure out.
Where the
Like,
right
how
point
you-
is.
I
So-
see it slightly different. If it's a high licensing fee, and there's already two of them, right? Then I don't think the price of cigarettes are regulated, but by having the cost of selling them is expensive, then the prices of selling it at the retail level will rise, and it will make it more difficult for especially young people to buy the cigarettes. So if I was looking at a chart, the tax in, I think it was Maine, was 50 cents a pack, and in New York it's something like $3.70 or something.
Yeah,
There's
it's
one
at least
state,
$1
I
a
think.
pack, outside of New York City, and then it's even more in New York City.
Oh, okay, well, maybe this was the city number. But if we can make it more expensive to sell cigarettes, fewer people will buy
Yeah.
them.
The other thing too, though, I know, is that we'd wanna set it at a price that doesn't deter that compliance, But
True,
the
you
other
don't
thing,
want-
the
you
other
don't wanna
thing,
create a
I don't
black
think,
market.
I don't think this body needs to determine the fee, because the way that it's written is that the annual fee would be established from time to time by resolution of the common council, so I think it would just go into that, I forget what
Okay.
I'm thinking of, the fee,
Like-
you know, structure that we have,
Okay.
you know, so.
I have one other question.
Mhm.
In the one that I read online, it mentioned cannabis as well as tobacco. Is the legislation we're going to consider it, will that involve cannabis as well?
I think right now we're primarily looking at tobacco.
Yeah, cause I think
And
there are really different rules for cannabis, you know, in terms of like the state dispensary, and I can't advise on that. I'm supposed to strictly be, you know, on tobacco.
Okay, because the one online that I read
I wonder
earlier
which
today
version.
mentioned cannabis. This one,
Yeah.
I'm not sure.
Because both of the versions that I looked at did not have the other, that you had. So we'll have to confirm which version everybody
So,
was looking at.
Do
I'm
we-
not sure if it was in that, there was an inspection
Because I
checklist
think
attached.
cannabis should be considered separately.
Yeah, so this one, yeah, I agree, is, the one that I've been looking at, you know, I don't know if, you know, how long you might have worked with the committee prior, but I know I've been with the committee for a year, and this is, you know,
That's about
what
as
we've
long
been
as
looking. Okay, alright, so maybe, I pulled out my notes to see, cause I know I take a lot of notes, and I was just looking to see if there was anything, you know, relevant, and the first one that I was at the meeting with you for was July 3rd of last year, so, okay.
I mean, the only, so I know that there have been a few places in Oneonta that were closed down, or at least one that was closed down because,
They were unlicensed.
yeah, and they were selling cannabis and they weren't state regulated. And,
Right.
and I think
Yeah.
they were supposed to be a tobacco shop, so.
There's only one legal cannabis dispensary in the city.
The Dasha,
Yeah.
yeah.
All of
That's
the
what I
others, if
thought.
they're selling it, they're doing so illegally.
So, well, do you have any other questions, though? Okay, because I do want, Hope came to the meeting, because I know Hope had shared an email with, I think, the mayor originally, I'm not sure where it originated, and it made its way to me, because I know that you had some concerns from the community perspective, and I was hoping you could tell us about those concerns, you know, because I think that'll help inform our process, and maybe also get some input from Jennifer, you know, on how we can make sure that we're addressing those concerns that you're bringing as well.
Yeah, thank you. So, I'm Hope Von Stengel, I'm from the Community Arts Network of Oneonta. We're right over here on 11 Fort Avenue. And, we are unfortunately, a smoke shop opened up about a year and a half ago. And the result has, has been, it's difficult on me and our organization. And because basically, and I, you know, looking at the ages of people going in and out, I would say these people are under 21 going in and out as well of the smoke shop. But they hang out at our pavilion all the time. I'm constantly kicking them out several times a day for smoking. And the majority of people coming over are from the 420 smoke shop. And it's not a good fit. We have a youth program in our summer, 5 days a week, 8 hours a
Exactly
day.
what I'm talking about.
Yeah.
8 hours a day, 5 days a week. I don't know why it is legal, you know, zoning wise, for a smoke shop to be so close to a children's program. The YMCA also has a youth program. They do not have a pavilion, so, you know, people from the smoke shop, it's just way too easy for them to come over to Kano. We looked at fencing, and unfortunately the city would require us to purchase more expensive fencing, and we just cannot spend $8,000 on fencing. We had a quote given by the
Yeah, I saw
company
it. You
for
had
that, for that small swath of space. But we wouldn't need a fence. I mean, for the most part, those are people coming from the smoke shop. And like I said, I speak to these individuals. Some of them try to smoke marijuana. One gentleman recently came from the smoke shop, and I said, hey, you can't smoke here, you have to leave. And he's like, I can't smoke weed? And I said, no, you can't smoke weed here. So it's, you know, I can't say 100% if I don't go in the smoke shop myself, but I do see quite a few younger people come out of the smoke shop. I know some of the other smoke shops in town have sold marijuana illegally, and they sell to minors. You know, but regardless of whether it's marijuana or tobacco, I'm constantly picking up trash, whether it be vapes, whether it be, you know, whether it be the packaging that vapes come in, you know, you know, like
The packaging,
yeah,
okay.
like constantly, and or cigarette butts or whatever, you know, and I think it's just not really a good fit next to a KISS program, but it's also the trespassing onto private property all the time, which I have to remind them of. We do have no trespassing signs, we have no smoking sign now, but it doesn't seem to deter them when I, you know, ask people to leave. Their response is, oh, I thought, you know, a lot of people from the smoke shop hang out here, I thought I could too. So they'll hang out and wait for the smoke shop to open. Again, people who look very much under 21, regardless of whether or not they are or not, it's just nonstop. Like, I drop my car off there on Saturday so I can go to the parade. I'm at Kano for a hot minute, kicking somebody out, you know, so I just have to even stop by Cato for a few minutes, and I am kicking people out of the pavilion. And again, before the smoke shop, you know, I didn't see people smoking there constantly, you know, sometimes people eating, sometimes people doing, you know, other things, but the amount of, vaping or smoking I've seen has increased exponentially since the smoke shop opened. And again, we do have, even during the school year, we have an after school program, you know.
No
for youth.
way.
Yeah.
I know.
I didn't even know.
You didn't know, your daughter is now.
My daughters didn't know here.
But it is, it's, and I'm, like I said, I'm, you know, one of, our studio artists said, wow, you're like a bouncer, you know, because I'm constantly picking people out. And I said, well, it's a good thing that I used to manage a bar, because I used to get
Yes, that's right.
individuals, yeah, I'm not shy about doing so. But, you know, and for the most part, no one's been confrontational. But what happens if someone is? Well, I am a 5-foot female who is often alone at Kano, and, you know, I also don't want it, like our assistants and our instructors know to do a perimeter sweep around the pavilion every morning before the program begins. You know, I don't, you know, so kids don't see any, but, you know, paraphernalia is sometimes dropped off, like during the program while it's happening, you know, yeah. That's my experience. Yeah.
Do you have a suggestion for us something to do?
I think there should be a zoning law. I don't think that smoke shops should be within so many feet of a children's program, a youth program. Again, I mean, it's nonstop, like, you know.
That's the one across the parking lot.
Yeah,
Oh, yeah.
yeah.
The
That
YMCA.
moved in where the Bearded Dragon used to be.
Mhm.
Yeah.
Yeah, I just don't think you know, smoke shops belong near children's programs. you
Yeah,
know?
I mean, there's a New York State law, that, tobacco retailers have to be, it might be like 1,000 feet from schools,
Mm-hmm.
Okay.
but,
Well,
We've got Kano there, we've got YMCA,
Right.
you know, I know that was one of the other ones.
seeing that's in my ward, there's a
Yeah.
couple of things I could say about that. One, the guy who cleans the bank parking lot, when I was walking by there, this was about a month ago, he came across a box of 100 syringes.
Mhm.
And the police offered some advice when they came, you know, being nosy. I hung around to see what the cops were going to say. And all they could do was remove they took the syringes, but they didn't take all the other stuff that was there with them, because it was just other junk, basically. And when during the discussion with the police, they pointed out, you have picnic tables there, is that what it is?
Yes.
Yeah, and he said, well, you know, they do their drugs over there at the picnic tables. And I was thinking,
I was gonna
that is
say.
not good.
Well, I will say,
So,
since I've
well,
called the
well,
cops
there's
many
one more
times,
point I wanted to make.
that has not happened nearly as much.
That's-
So that was an issue
Yeah.
2 summers ago.
Oh, wow.
So that was an
Sorry to
issue
hear.
2 summers ago, and
Well-
since I call, since, you know, we would, our
Right.
board members or I would call it the police all the time, that activity I really don't see
Right,
so much
but
anymore.
what about removing the picnic benches for a period of time and see what happens?
But that's where the kids
That's the
hang
same
out
you're
all
doing, yeah.
summer long.
Like the kids that are in your program.
Yeah. So that's where they eat lunch, that's where they have outdoor activities,
Mhm.
you know, so, and again, we see the most traffic, well, during the warmer months.
Mhm.
And that is when our summer program is, yeah, I mean, and the kids are outside, I can't tell you how many times
Yeah.
a day, so, you know, and the picnic tables are very heavy, I don't think, and just putting
They're
out
not portable.
temporary ones, no, I think people would go, because it's a pavilion, they would go underneath there and smoke regardless, because it's shelter from the rain, shelter from the sun, and not only that, or they would just hang out on the grounds, because it's so close to the smoke shop. So it's, the problem, the issue is the smoke shop is so, like, close, you know. I mean, we had an issue, and I contacted Deeds Lofts about this, you know. We had an issue, for example, just because we have grounds and the Deeds Lofts are there, tenants letting their dogs defecate on our lawn a lot, and it was quite an issue. I had to, so we have a green space. It's next to a smoke shop. I could get rid of the picnic tables and the kids wouldn't have any, but also they would come and hang out underneath the pavilion anyway, you know.
And so it sounds like it's that exposure element that you were talking about, you know, just,
I was just gonna
yeah.
say, because when I was getting food from Hunan, anyway, somebody from the lofts had come out and was smoking weed at the picnic table for sure.
People from the lofts, I've had issues with them, and I have contacted the lofts manager, several times. And I would say that's probably 15% of our traffic are people from the lofts. You know, all I can do is contact their management and kick them out, you know. I don't understand why they don't use Huntington, you know, Park. I mean, it's a public
Okay.
park, we're not a public park. I've explained this to the management.
You can't smoke in Huntington Park
Yeah.
either.
Right.
Well, I mean, I don't, like, Deeds Lofts, I don't know if, you know, I have spoken to Mayor Mark about the Deeds Lofts as well. Yeah, I mean, between the Deeds, I will say, you know, the smoking situation increased, obviously, because the Deeds Lofts is also, but I would say the majority are from the smoke shop.
So, but hearing all that, I'm not, you know, what we're working on now, I think is very important, but I'm not sure if that really gets at, you know, like, really addressing, because it does sound like it's more like this zoning thing that you would also mention, Jennifer, or, I don't know if
Yeah.
there's,
And you
What-
can
yeah.
definitely include in the policy zoning
Yeah.
laws. Like, you could write your own zoning
Yeah.
section of it, so many
Yeah.
feet from where, you know.
children's activities or
Yeah,
whatever
you could
to
define
define,
that.
okay.
In the more, well, possibly shorter term, there are a couple things. So one is, the acronym is ATUPA. Please don't ask me to remember.
Okay.
But one of the things they do is they will send like 16 to 24-year-olds into tobacco retailers to try and purchase.
Like undercover stuff.
Yeah. Undercover agents. Because also if this place is selling, I mean, it sounds like they're selling products to underage people and they're selling pot possibly, and they're not state registered. So, I mean, you know, they could be fined, and, you know, again, like, there was at least one store that was shut down for doing that, like a year.
The one in question here was raided by the police. I think there the county and the, you know, the city police did it, but that was a while ago.
Right. Yeah, and I kind of wonder, like, what all led to that? Like,
Yeah.
you know, was it people calling in and complaining and, you know, or,
Well, how many feet is it from the Y and from Kano? And we should
I
get
wish
a-
Not
I
very
am
far,
like
not
absolutely
bad.
awful.
we can
with-
Google map it.
Yeah.
Well,
Yeah,
if
okay.
we- if-
Say it's
I
not
don't think I
far.
know.
I would have no
Location.
problem adding that to the local laws, saying
Yep.
whatever the number of feet is, and add, you know, 50 or
I made
whatever.
a note for that, you know, so
I
that we
love
can
that.
add that, you know, kind of.
Because it's very,
definition.
it is quite close, it's
Yeah.
just across the parking.
Yeah, and
But
it,
then
and
the
if you can
difficulty comes
specify-
actually shutting them down. That could take a while, but.
Well, I think, yeah, for something already established.
I don't know that we
I don't
should
think-
target like that. I don't know if that.
That's what I'm saying, I think with a new regulation, I don't think we go to shut them down with that.
Right.
I think
It
what you
would
do is
be-
as new places are licensed.
Right.
Okay, that makes sense, yeah.
I like the idea of sending, you know,
Yeah.
people
That can
16 to
happen.
24. And like you said, it's,
Mhm.
I also heard that it had been shut down once for illegal activity.
It is called 420, I feel like they're asking for something.
Why are they allowed to even have a name that says 420
Well,
when
I
they're
don't know
not
what
selling
420
marijuana?
means.
It's, yeah.
I'm old.
You don't know?
No.
Okay.
Weed.
Oh,
It's what time
Yeah,
people like
it's
smoke.
Yeah,
and
they
get
smoke it
It's
allegedly.
a
oh,
cigarette
at
one,
420,
yeah,
like,
yeah.
cocktail hour or something.
Right, and then
Yeah,
on
there
the
you go.
date 420, everyone.
Yeah.
I don't know. I don't.
Hilarity ensues because everything.
Alright,
But you're probably right about zoning, like you would probably have
It
it
is
sort of grandfathered in.
yeah.
But it does sound like it's really worth looking into, you know, having tobacco retailers be a certain distance from where there are definitely like kids. you
I
know,
remember
whether
we
it's,
talked
like,
about
programs or-
schools specifically, I feel like, but yeah, I think, cause I'm feeling like I definitely need more time to, you know, really digest this, you know, and then look at where we could, you know, add in some zoning, so, you know, I hate to keep dragging this out, but I know that I also wanna make sure that it's something that I understand before we move it on. And with that in mind, maybe we should, you know, over the next month, you know, really read this, you know, see where we can add that in, make sure, you know, look for those little pieces that we had questions about, and then come back and look at it again, you know, before we, move that along to
And
legislation.
talk to Dave.
Yeah, that's what
we
I
can
meant,
do
yeah,
and-
as far as our questions, you know, with that. Does that sound like a good process?
Mm-hmm.
Okay, you know, I have another thought, I mean,
Yeah.
and I don't know if it's possible. I know that if you're in, so many feet within a school and you smoke, there's a fine.
Mm-hmm.
So is there, you know, any way that if someone trespasses onto Keno grounds, because, you know, it would be trespassing, it's not a public space, we own that area, people can get fined for smoking? Is that what,
I
you would know better than I would.
It's not great to fine like the user. Like for trespassing, yeah.
Yeah, I was gonna say trespassing, that's definitely something, I think you know, could report that to the police if you haven't already, but definitely.
I mean, like in the tobacco retail law, the penalty should go towards the retailer and the sellers of it, not, you know, the consumer. There's one other thing, and that is, there is no safe legal way to dispose of vapes.
Oh, thank you
So-
for bringing that up.
So the thing is, they, especially because most of them have liquid nicotine in it, that is a hazardous substance deemed by the EPA, although, like, who knows what's happening with the EPA these days, but, you know, that means that if a small child, I mean, we're talking top, or animals ingested, it can kill them. And so that needs to be handled in very specific ways, and there's no setup to do that. There are also lithium batteries inside vapes, and they can explode because if they're left outside, they biodegrade. And of course, like, nothing about the vape will biodegrade at all.
Mhm.
But the problem is there is no real system to collect them. throwing it in the trash is not good. You know, like legally, that shouldn't be happening. Again, like trying to establish a law around that would probably take a while. There are even only like a few places in the country that right now have like kind of ways to dispose of vapes that go according to law and regulations. But yeah, that's just sort of another thing.
Just
I'm
something to
thinking
be
of,
aware
too.
of. Yeah.
Yeah.
I appreciate it. Any other questions that we have about this? Okay, so we'll keep plugging away on this.
No, thank you so
for sharing.
much.
Thank you for, you know, the information. Really appreciate it.
Yes.
The other things that I had on here, okay, are really just to introduce, like, the food security. I have reached out to the Hunger Coalition, because with changes in benefits that are gonna be coming
Right,
around,
well, I'm
food
nervous for
security is
everyone.
becoming, yeah, exactly. So you know, that seems like something that we should be paying attention to.
I agree.
So I included the Hunger Coalition list, just for us to be aware of here, okay? And I reached out to the person who organizes it, you know, and I'm gonna try to see if maybe we can get somebody from the Hunger Coalition to come to a future meeting to talk to us about ways that the city could support their initiatives and efforts. I mean, even just like hearing from, you know, your Safe Haven about, you know, the kinds of support that they could use to even further, you know, potentially some of their programs. So I really just wanted to introduce that, you know,
Right.
to the committee. I don't really have anything further to share on that right now. I just wanted to get the resources out there so that it's, you know, publicly available so we can share this information, but also just kind of start to think about the kinds of things that we might do to, you know, support food security in the city.
Right. Have they stopped doing that card when you visit?
I'm not sure.
It used to be that like you would get a card and like if you went to like the, you know, one of the ones here, they would like stamp the card and you couldn't go to any other one.
Oh, I don't know.
Okay, I'll ask around.
Yeah. So yeah, so we can, I will work on, you know, hopefully, and that got sent out too if you want it in PDF, Shannon. Okay, I can even send it to you separately.
I love you.
That helps. Okay. All right. Thank you for coming. Thank you.
But I hope.
Oh, so the other thing, okay, so we've got food security on there, and this is really these, you know, social supports, right, that we were talking about, okay? Food security, so we'll introduce that one and we can talk more next time, hopefully have somebody from the Hunger Coalition and talk to us. Homelessness, I put on here as an update because I you know, just wanna keep this on the radar
Yes.
so that, you know, folks in the city know that yes, the city is paying attention to this. So earlier today, I did attend a meeting of the Greater Oneonta Homeless Coalition. The United Way has been organizing that for about a year. And so one of the things that I can show you that has just gone out, and I brought copies to share with everybody. There are now these flyers that have been distributed downtown.
Thank you.
Yeah.
Thank you so much.
Oh. Yeah. So these are just you know, this is just to give some resources because I know downtown, especially, you know, business owners and folks downtown, had expressed concern about how do we help folks that present themselves and may need some assistance.
Right.
So this just gives a very simple, you know, point of entry, you know, for services, you know, to contact, you know, call or text 211, and they are a point of entry into services. Okay.
Yeah, I've
So-
definitely noticed. Oh, sorry.
Yeah, no, just along, you know, I just had some more information here about, you know, SNAP cuts, and we just know that as food insecurity, housing insecurity increases, you know, the pressures that residents are facing is going to increase as well. So.
Yeah,
I took
that's
that
what I was
picture
gonna
last week.
say. I have been noticing new faces.
Yeah, I have heard that trend.
I am.
Okay.
So that's
Where was that taken?
under the bridge
Okay.
that goes
Okay.
over Main Street across from the police department.
Oh,
So
okay, yes.
he was
Yeah.
unconscious and I couldn't get him to wake up, so I went over to the police department and they were gonna do,
A well check
A
or
well
something.
check.
Okay.
I think they took him to the hospital, but,
Yeah.
the problem is still growing.
Yeah, so it's growing, and I think, you know, we're recognizing along with food security, housing security, all of these
They're
things are
all
getting more
interrelated.
difficult, they are absolutely intertwined. So, all right, in this Greater Oneonta Homeless Coalition, and it's a great group, United Way is there, Family Service Association, Opportunities for Otsego, we have representatives from Otsego DSS attending, and so one of the things that what came out during the meeting that I would like everybody to be aware of is that it was noted that Catholic Charities, their involvement had kind of dropped down, okay? And the status of the warming station right now is very unclear for 2025-2026 season.
When you
okay?
say their status has dropped down, what do you mean by that?
Like they have not been able to participate as much in the meetings, okay? Because they lost the coordinator for that warming station, okay? So we are unsure of where that program is going or if it is supported
Do
for
they
the
have the
coming year.
money for it?
I don't know. Okay, so
Well, so that'd be a big
what
problem
was the
if
cost
that
of it
doesn't
last
open.
year?
So
Yeah, that
what
I'm
can
not
we
sure.
do?
We'd have to
What
find
can we
out.
do as, you know, the city?
yeah, I thought we should be aware because I think folks, you know, there were certain segments of the population that came to very much rely on that warming station.
Yes.
And I think the community came to expect that that was available, you know, for folks as well. So I do not know. I will share updates as they become available, you know, because I know that that's definitely a concern, you know, for many folks.
Do
That
you
was
know-
that
do
was
you-
the big
oh, I'm
piece that
sorry.
I
Go
wanted
ahead.
people to know is that this warming station, I think, you know, when we talk about cooling station, the status of that is very unclear because there's not actually funding that goes along with the cooling
Right.
station. That is definitely more, it's not as well defined, right? But the warming station, I think we felt like was defined, it was set, and I think we've come to expect it, and I just want us to know that that status is unclear at this moment.
Cause it's July,
Yeah.
so if we can go fund that baby.
Yeah, and I think that's, you know, that's why I wanted to continue to be on the conversation, because the cooling station idea we came up with last summer, and we
Right.
started talking about it over the winter, and we're still talking about it. So these are, you know, issues that will need attention and don't, you know, have direct answers, but will need our, you know, attention to work through them, so.
Who owns the building and who paid for it last year?
So, I mean, it was the Catholic Charities ran the program, but I don't know who owns the building. I would have to find out.
So the money came from Catholic Charities.
So they had a grant, I understand, to administer the program, but yeah.
And we don't know if they've applied or gotten more money.
Yeah, I don't know the status of that. I just know that they don't have
But
staff.
their
The staff
staff,
who directed
was-
the program,
right.
yeah.
And I think that there was always 2 or 3 people on, you know, at the
Yes,
facility.
they had
and
like
they were
direct staff.
paid,
Yeah.
they were professional
Mhm.
staff. That's not good.
Yeah, so I wanted to, you know, basically what they were saying is that efforts to get the warming station started up really start in August,
Okay,
Okay.
so.
and it opens in October, I think, is that right?
It depends, I think.
It
Weather?
depends on the weather.
Yeah, it depends, but then they set a date and then, yeah.
Right.
But it was
So-
around that time.
Not because you need anything more to do than all the million things you already do. So we're gonna message Catholic Charities and ask them if they've
Yeah.
applied.
So actually, I know that
Cost.
Patricia Leonard from Family Service Association was gonna find out more about
Oh,
the
okay.
details. And so I will wait to hear what her, you know, if she found out rather than bug, you know, but if we don't, you
Because
know.
our community is willing, we just raised over 7,000 for James's mural. We're raising money for the
It's getting
splash
close, I
pad.
heard, so,
Yep.
yeah, that's exciting.
We have ideas, and if we need to do it for the skate park, I feel like, if we're not talking about $30,000 by October, I don't know.
So that's a good question, I can try to find out.
Or who can apply for this grant? Like,
Yeah.
what kind of are we looking
Yeah.
for?
Mm-hmm.
I know the staffing is at risk, I'm not as clear if the funding is at risk, so we'll find out, yeah.
Well, if they have the money, hopefully they can find a person, but that's the first thing to ask, you know. Why, you know, what are you missing?
Yep.
How can
Always something, right?
Yep. All right, and if I get further updates from the coalition, I'll share it, you know, so that you can be aware and updated as well. Okay. What else? We had on here volunteerism. So again, this is something that I wanted to introduce because this has come up. This committee has talked about volunteerism, but also it keeps.
Good night.
Thank you
Bye.
so much.
Thank you for coming. It's nice to meet you, Jennifer.
Yes, take care. So also volunteerism keeps coming up at other meetings that I'm at.
Mhm.
Like it came up at Quality of Life and Infrastructure Committee, it came up at the Budget Review Committee. So I said, you know what, I'm on all of those committees, you know, and let's continue to have these discussions happen. So again, this is a conversation that I wanted to open up about, you know, how, you know, what we feel we can do to facilitate volunteerism. One effort that I did make already was a connection. I connected up the assistant director at Springbrook who works in employment services with Greg and with you know, with the city administrator and with the mayor to talk about the potential of having some folks who are enrolled in their employment services who are looking for volunteer opportunities for their vocational training or assessments and things like that. They're always looking for sites. So the hope is that there can be a connection there to maybe help out with some tasks like watering plants, trail maintenance, you know, things like that. So that is what I have done so far, you know, as far as this goes. So I wanted to update you. But yeah, if there's other ideas around volunteerism, this keeps coming
Right.
up.
I still think we need an app.
So, an app,
I
yes,
think
and
we
I
need
think
an
that would
app.
be the best, like some kind of database, you
And
know,
it can
system.
connect to the city website, and the people can put their own, like, whatever they have as an opening available, so that it's monitored by the organization or the person or the group
Yeah.
versus the city,
Right,
not putting
like that it
burden
sends
on
the
them.
information to them,
Right.
yeah, to
And
connect.
then people can just access what's still available or what's not, or what's required, or
Yeah.
what they're looking for specifically.
Yeah, I think that would be great. I would love to see something like that, because the United Way used to operate a volunteer database, and I checked with them,
They
they don't have that funding and they don't do that anymore, so.
Thing about volunteers, people will volunteer for something they're interested in, but they don't
Yeah.
wanna go to it like a volunteer. I'm gonna
Right.
volunteer whatever you want, you know?
Yeah, I think
It's
that's
like-
why, you know, matching people like through an app, like you're saying, like
It
they can
makes
take out the
sense.
specifics, you know, and really tailor. So I think, I agree, I think that's something we should look into as well.
So can we, as a city, have that on our website?
Mhm.
That sounds like a Carrie question.
That's a King. Carrie already said yes, because I
Okay.
used that thing has been.
Okay, so I think then it's, you know,
So
how
how do
does
we
that
do
get
that?
developed or managed?
Right, we gotta get it developed.
Yeah,
That's
Yeah.
gonna
Who-
cost some
who
money.
does- Oh,
so,
like
okay.
how much do you think? Is that hundreds or thousands or what?
I wouldn't be the right person.
Yeah.
I'd be lying.
Okay, so it sounds like there's interest and we should do some more research.
Yes.
Right.
I think everybody is down for it, but then
Yeah.
it's who builds the app.
And how does it get funded and blah,
Right.
blah, blah, okay.
Or we could give it to a Suco or Hartwick or Job Corps student who's learning how to.
Yeah, it
Oh,
doesn't
and
have
you
to,
get
really-
yeah, it
intern
might not have to
credits.
pay,
They can
or
get
something like
intern
that.
hours and intern credits to build
Yep.
us an app. And
That's a good
connect to the
idea.
website and
Okay.
build a database.
All right. I mean, this sounds like things to ask Carrie about, as far as, you know, like putting up this stuff, so I can follow up with her and see what she thinks too.
no, that's good.
Any other ideas around that?
Nope.
Any other items? I have one more quick little item
Yeah.
to tell you. Okay? So there was this idea to do some, you know, especially this year with the ticks being so bad locally. I reached out to Otsego County Public Health about the potential of doing a presentation on tick education. And we could do, like our committee could do that in conjunction with the Climate Smart communities. And, you know, potentially bring somebody to the city to do a tick education thing. So that's the kind of thing, I've already contacted her, she said, yes, she can do it, you know, I could get some details and let you know where that goes.
I think the county does like tabling in relation to ticks.
Yeah, I think they do. I
it was the
spoke to their
county.
public health educator, So,
They
yeah.
were giving away little kits with tweezers and
Yes,
stuff.
I've gotten those before. Yeah, that's handy. Okay.
My daughter Jessie keeps a tick thing on her keychain,
Oh,
like it scoops them out.
I already picked one off. Well, I didn't. We saw it, and my wife picked it off of our kid this
Mhm.
last week. Yeah. Okay. All right. So I guess if I can get in contact with her, and find, at this point it's already summer. I think getting it planned sooner rather than later would be the thing, and just that'd be a matter of finding time that the presenter is available and that we can get space here, unless there's any other thoughts about how it should be arranged.
The idea is to have the public know what to do
Yes.
and what to look
Yeah.
for. And I don't know if having a presentation here is the right venue. Maybe it's, maybe Mark would like this, during one of the free concerts in Noel
Ooh, yeah,
Plaza.
do it outside.
That kind of thing, where
I mean,
it's
that's definitely
outside
what I'm
and-
thinking. Like, how can we reach the most
That would be,
people?
I
Like on
think,
one of
more
those, like
appropriate.
Friday, Saturday
Yeah.
events. Oh, I'll
Yeah.
ask about that.
Because having it here,
I agree.
is,
So-
no impact.
Yeah. No, I totally agree. And I think, the more that we can get it to the public rather than asking people to come here would be helpful. Because the other thing that I asked her about, I said, let's talk about this later because we should do the tick education thing first because it's summer. The other thing she does education on is Narcan training. So we could also arrange that with her.
I got my
I'm trained.
Narcan.
Yeah.
Got
Yeah.
the kid.
Yep.
I hope
One
I
in
never
the
use it.
car, one in the house, one in
Mhm.
I don't wanna
Yeah.
have to be in a position to save someone like that.
Right. But it's better to have it than
It's
not
good.
have it, right?
Oh, yeah, that's why I took the training.
Yeah.
It's not hard to do.
No, it's not. It is, and I've taken the training a couple of times now, and I found it helpful because each presenter you learn something new
Mhm.
too. So, and information keeps getting updated. Like ones that I did 2 years ago, they're now presenting different information. That's been updated. But yeah, I think
Does
that's
the
everything.
Narcan expire?
So
Mhm.
it does, but they are saying, at least the last time I took the training, they said use it anyways.
Okay, because I haven't looked at it lately.
It does
Some
expire,
people
but
need
something is
multiple
better than
doses
nothing.
of Narcan too.
I've
Yeah.
heard that, and it doesn't
Yeah.
hurt. You're not gonna, you can't overdose on it.
Only
Correct.
way it would be problematic is if they're diabetic.
Oh,
Ah,
interesting.
okay, I didn't know that. Or I probably was told that, I didn't remember
I
that.
don't remember that.
But there's no way of
That's
asking,
Yeah.
because the person
There
could be unconscious.
Is not.
Yeah.
So
Yes, they have a thing.
it's better to just, if you suspect that it's drugs. I mean, if you've seen someone with low sugar, you might know what that looks like and know the difference. I don't know if you have. Some people do. But, if there's a stranger on the street, just, edge on the side of
Yeah.
caution and do the Narcan.
Yeah.
'Cause
Well,
So
that guy
in the
that I
same
showed you the
vein of like
picture of-
bringing these things to people rather
Mhm.
than bringing a trainer here where, we'll get to hear it,
Mhm.
but not the general public, should I
Right.
ask her about, it sounds like that might be another good thing to, bring to a more public facing kind of event.
Right. Make an
Okay.
announcement from the stage,
Yeah.
there's a table over there,
Yeah.
and, the
Great.
guy that I showed you the picture of, he was unresponsive when I tried to wake him up,
Yeah.
so.
Where was your Narcan, Dawn?
Well, I didn't have it on me, I was walking Danny's dog.
I have one in my bag now because one of the last trainings I did, that was kind of the little plug. They were like, you should always have it. And I was like,
No.
I don't know. And they were like, look at the size of that. But, because I
I
carry
don't
a
know
bag,
if that was
so.
appropriate to use Narcan on that guy anyway, I don't know what, he just wouldn't wake up, so I called the cops, or went over to the police station, they went right over.
Are we all done with business then?
Yep.
Okay,
Mhm.
meeting is adjourned then,
Awesome.
6:40.
Thank you.
All right, is that a real, like,
I
key
still
that
have
we
to
use,
work.
those